It was revealed late last week that Colorado's Department of Public Health and Environment, which is the agency in the state that reports on the death totals and, of course, oversees a lot of the actions being taken, steps being taken to address the coronavirus pandemic, that their death totals had been inflated. That is to say, by, at the time, 272, the number was higher than it should have been of totals dead due to the coronavirus. That is to say, the number included 272, it was 1,150 or so. 272 of them were people who died with COVID-19 in their systems at the time of death, but did not die because of COVID-19. That is about 24% of the total. This was uncovered not by somebody in the Polis administration, but by State Representative Mark Baisley of Colorado, who did a little bit of digging and uncovered this discrepancy. State Representative Baisley is kind enough to join us now here on Jimmy at the Crossroads to talk about this and the implications perhaps nationally. State Representative Mark Baisley, welcome to the show. It's good to have you.
Great to be with you, Jimmy.
So I just set the table a little bit on what's happening here with the coronavirus crisis and the numbers, the death totals. Give us the basic story of what you uncovered and why you brought to the attention of the Colorado Department of Public Health and Environment.
Sure. Well, we've all just heard a lot of jokes, and I probably even participated in some myself about if you fall out of a plane and land on a rock that you died of COVID-19. But it became a reality to me when a constituent brought a letter to me from the nursing home where they have a parent staying. And the nursing home had put out a letter to all the families saying, hey, listen, we're not riddled with COVID-19 here, but because we have a lot of deaths, because that's what they do. They escort people off into eternity and give them comfort through the hospice care that they have there. But the state health department had been overruling the physicians or the funeral directors' designation of cause of death on death certificates, and changing them to COVID-19. So that was, of course, inflating the numbers massively. And so I called up the executive director to ask for an explanation, help me understand why are they doing this, because as I was realizing, it was affecting people's lives. It was not only a personal affront to families whose family member had passed from just natural causes or from heart failure or something, but also this is affecting healthcare workers and nursing homes, hospice care's reputation. The biggest impact happened with out on the west or the far west, southwestern corner of Colorado, where someone had died of alcohol poisoning with more than twice the amount that was necessary to take his life, and that was determined as a COVID-19 death, and that was overriding the coroner's determination of cause of death. So this has affected a lot of people. In fact, that caused that section of the state to not be allowed to start opening up their businesses because of that. Put them over the top, I guess, in the eyes of the health department. So that was my discovery, was looking into what's going on with the overturning and what's the actual effect. And I researched in these books here behind me, which is Colorado state law, and discovered that yes, it is illegal to falsify the cause of death on a death certificate, and that's what was being done.
Now, Governor Jared Polis of Colorado was on Fox News Sunday yesterday, and Chris Wallace at the very end of the interview, kudos to him, asked the governor about this, and you would think that Governor Polis himself made a decision that, we need to actually make sure we're providing the right information to the people of Colorado. Take a look at what Governor Polis said yesterday on Fox News Sunday.
Finally, your state just changed the way that you count COVID deaths, and as a result, you lowered the total in Colorado from about 1,100 to 878. One, why did you change that process of how you count them, the criteria for that? And two, Do you think the number of deaths should be a political issue as it seems to be becoming?
No, in fact, one of the reasons that we wanted to make sure we reported it out in a better way is to inspire confidence so that it wouldn't be politicized, Chris. These are deaths that should not be politicized. The CDC criteria include anybody who has died with COVID-19. What the people of Colorado and the people of country want to know is how many people died of COVID-19. In our state, about 900 have died from COVID-19 on their death certificate or from the attending physician. About 1,100 have died with it. That those 200 in the middle, it might have been a contributing factor, but it wasn't deemed the sole factor or the only factor in their death. I also want to point out, Chris, that of course there's likely cases that should be counted as COVID deaths that people have missed, doctors have missed. There's probably some of those as well. But the numbers are all fairly close, whether it's 900 or 1,100 in our state, a few 100,000 across the world. We know that this can kill people of all ages. It's particularly dangerous for people in their 70s and 80s and those with pre-existing conditions. But it's a bad bug.
Colorado State Representative Mark Baisley, he says that we're reporting it out in a better way to inspire confidence. You would think that he had a revelation that, hey, we didn't just provide better information, but this didn't happen until you, a member of the legislative branch, uncovered this. And Governor Polis, keep in mind, is the one who oversees the health department at the state level.
Yeah, so as I've learned in the past 3-4 days since I sent my letter to the district attorney asking for him to investigate this criminally, there have been a lot of appeals to the governor to accurately represent the number of deaths. So remember, we all were joining arm in arm to fight this pandemic originally to flatten the curve. And the health department put out its order and said, here's how thou shalt behave in order for us to flatten the curve. And here's the bother to me. They say in the arrogance, they end that order with a threat of jail time for up to a year and $1,000 a fine if you do not comply. So they're coming at this as a criminal act if you don't comply, and then they conflate the numbers, putting a couple of different numbers together. As the governor was talking about, there are those people who actually died from COVID-19 and those people who died and had been infected by COVID-19. So it is in their system, but it did not cause their death. But what's important to the people of Colorado is not what's important to CDC, perhaps. So I don't really care what is reported to the CDC as long as we're doing that accurately, and that's fine with me if they combine numbers. But the state of Colorado, the people of Colorado who are under the threat of jail time if they do not comply, they need to get the accurate numbers. They need to trust that what they're being told they shall do in their behavior is based on accurate numbers, and that's not what was happening.
Mark Baisley, state representative again in Colorado. I know that from Colorado's standpoint, it doesn't matter as much what's reported to the CDC. But I'm very curious about the specifics of what's being sent over there, particularly because national policy and policy in many other states are being shaped by the national numbers, national death totals. And I don't know if this gives us a lesson that maybe this is a widespread thing where numbers being reported to CDC by request of the CDC are basically inflated counts because people are being reported as having died of COVID-19 when COVID-19 was not the cause of death, may not even have been a contributor to the cause of death, such as, for example, the alcohol poisoning situation that you were just describing.
So, Jimmy, I spent some time on CDC's website this morning looking at not only Colorado's numbers that have now been modified to show that we stand now at 878 confirmed COVID-19 deaths, which, by the way, that number has not changed for the past 4 days, while the number of overall deaths, or deaths that included COVID-19, that has gone up on average about 42 people per day. So that's quite a number. But when I look and compare to all the other states that are reporting, then our numbers are kind of similar to where it's about a 30 and sometimes 50% difference between the numbers of people died directly from COVID-19 and those who were died and also had COVID-19 in their blood. Then so the numbers are similar, and I think it is a problem across the U.S. because especially in the blue states, and ours, I like to think it's still got a purple tinge to it, but pretty blue right now. And those folks that want to keep their thumb on the folk and on our behavior and keep us in our homes and keep people out of restaurants and so on, it justifies their behavior if the numbers are higher than they actually are.
Yeah, when it comes to COVID-19 deaths, I'm looking at a graph here from the Colorado Department of Public Health and Environment. Deaths caused by COVID-19, that's what Colorado is now going to be presenting to the people of the state. But then deaths among people who had COVID-19 at the time of death, causes may or may not have been COVID-19, report to CDC. So while this change in the policy will impact what Coloradans are presented with, it's not going to change the numbers, it seems, that the CDC offers, and that's pretty striking to me.
Right, and there's another little detail that I discovered this morning, and that was while looking at the CDC website. Are those numbers inappropriately? Are those death certificates? That's the real crime, because that's specifically the state statute, is you cannot falsify the information on a death certificate. No person is allowed to do that without committing a crime. And the CDC website says that their numbers that they are tallying up are taken directly from the death certificates that are submitted to the CDC. So, that's where it's coming from. So is there conflation? Yeah, there's some combining of numbers, but it seems to me, and then you have to figure this out, and I think the district attorney's office are they're going to be the investigators that figure this out, where the numbers simply put together so that it's we add this column and this column and this column, and we give the more desirable number to tell the public so that they're scared into compliance, or do they actually write on the death certificate, which is what I suspect and what the nursing home suspects or says that they did? Are they changing the death certificates themselves? Because that is simply wrong. I would think that would be wrong in anybody's book. So, if the governor is he's on board now and he's saying, hey, he used the terms, let's not have a bureaucrat sitting behind a desk overturning the determination of death on a death certificate. I'm with him. We shouldn't have done that in the first place.
It's like it's too little, too late. He's late to the party. I mean, I posed this question earlier. I referenced my ColoradoPolitics.com column today, where I'm a columnist locally, and I asked the question, so why did it take a state representative in the legislative branch to uncover what an executive branch agency was doing? And so I want to pose the question, and then I've got one other topic I want to ask you about. But on this one, the final question for you is, how would you answer that question? I mean, it seems to me that these numbers were specifically presented to the people of Colorado intentionally inaccurate in order to help undergird some of the more restrictive policies and some of these setting aside of existing laws that Governor Polis has been doing in the state.
Well, I think the right answer is that nursing homes especially were afraid, because I have heard from other nursing homes since Friday, since this all broke, or Thursday when it all broke, saying, yeah, me too, hashtag. That has happened to us as well. And I'm calling on them to step forward, because it's affecting their reputation. It's scaring the families from bringing their elderly to them for hospice care, afraid of that place being full of COVID-19 patients when that's not the case. So I asked them to step up, and they're afraid to. So that's why I think it took someone bringing it to my attention. I just simply called on the department to let me know, what are they doing when they ignored me? I just did the digging myself and found that, yeah, this was, and think of this also. Here's something I discovered in these books behind me as well. Who determines cause of death? Well, it is the attending physician, it's the funeral director, it is the coroner in many cases. It's never the state health agency, but for the past 2 months, they have involved themselves like they've never done before historically in overturning the cause of death for hundreds of Coloradans. So this is unprecedented. It's obviously a falsification, and it not ought to have happened in the first place.
It's absolutely stunning. State Representative of Colorado, Mark Baisley, one more topic here. I want to ask you about the state legislature, because there are a lot of legislatures like Colorado that had basically said, we're stopping session midway because of coronavirus. We don't want to contribute to the spread of the virus. Colorado's General Assembly, which is the name for both the state Senate and the state House, will be returning next Monday. Tell us the mindset at the Capitol of getting things going again, and what insights you can give for other states that may not be reopening their legislatures yet.
Sure. So we're actually going to resume a week from tomorrow, Tuesday, just because a week from today is Memorial Day. So we'll skip that one day. We're coming in with a whole new set of priorities, to where with the Democrats having the trifecta in Colorado, there were all of the blue ideas were coming through as bills, of course. Those have all kind of been set aside, because with our $36 billion, I wish it were million, $36 billion state budget, we are losing about 10% of that. It's going to be at least $3.5 billion loss in revenue from business and other activities because of the coronavirus impact, the pandemic impact. So the priority for us is going to be figuring out how do we cut back on this budgets, because it's going to be a lot of painful cuts, a lot of things that'll go by the wayside that ought to go by the wayside, but it's going to hurt in a lot of other areas. So there will be a lot of camaraderie of us coming together to figure out how do we continue providing the essential services with the new lower amount of revenue coming in. There will be some bills that will be wrapped up, and we were supposed to have been done as a state, because we have a 120-day session. So we were supposed to have been done on May 6th. So we're extending that a bit now, and when we come back, and there will be some bills that will be completed that were already well underway through the approval process. But I think the real controversial bills that were in the queue are going to be set aside. I think we're going to be working together a lot more. For one, a lot of our Democratic friends are also appalled at the heavy-handedness of the governor. That there's a lot of real polite talk, but a whole lot of threats and businesses whose licenses are taken away. It's a real painful oppression that's going on, and I think everyone's feeling that.
Well, and then at the end of the column that I just mentioned that I have for Colorado Politics, again, local publication, actually a sister publication of the Washington Examiner, interestingly enough, I end it by saying King Polis should be dethroned and demoted back to governor. Let the General Assembly begin the revolution when it returns next week. And I hope what you're saying about Democrats will be an indicator that they will push back as well against the governor. But I think a lot of people are also curious how the state legislature in Colorado might be handling the social distancing aspect of all of this, because that's a big concern for people who are figuring out, okay, is our legislature going to open back up? How is public going to be allowed to come in? Lobbyists and so forth. What's the General Assembly in Colorado doing about that, Mark Baisley?
It's going to be tough on the public. There will be very little, if any, public access. It'll probably be all accessed by remote, Zoom or whatever streaming that they will be doing, and some allowance for interaction for, public comment and so on. But there will be distancing. So there's two things that are going to happen. We have a gallery, so we have the House floor, and then the Senate has the Senate floor, of course, and then up above, surrounding us, are a lot of seats for the public to come in, and that's the gallery. So they're going to move about half of us up there so that we will be seated every other seat on the House floor. That's one, and then some people are simply not feeling safe enough to be in the room with the rest of us, so a couple of people will work from home via some remote access.
That's interesting. That is legislating in a COVID-19 world. It should be fascinating to see how it unfolds from that standpoint, and then what lessons other states can learn, as Colorado, I think, is one of the first legislatures now to return to the business of the people. And hopefully it won't be long-lasting. State Representative Mark Baisley of Colorado, I'm so glad to have you on. Thanks for joining us, and thanks for your yeoman's work taking the Colorado Department of Public Health and Environment to task, and especially Governor Polis and his appointee in that position to head up the health department, because it's absolutely essential that we have transparency and accountability in government.
You know, I'll just leave you with this. Those who think that the role of government is to manage the people, they're the ones who are going to push for oppressive acts of forcing people to stay home at the threat of jail and so on. But those of us who understand that the way the founders put this nation together is that government is to ensure the people's right, including their right to pursue happiness. So we have to have that attitude rather than one of managing the people, and we will get there faster.
Well said.
Thank you, Jimmy.
Colorado State Representative Mark Baisley, thank you again, sir, for joining us today here on Jimmy at the Crossroads. I just want to add this, and I made this point before, that there is a lot of distrust, understandably, among people across the country of officials, whether elected or otherwise, who have made decisions and have made those decisions irrespective of the sentiments of the people they represent, whether they were elected to represent or they were appointed in roles to protect the people. They've taken it a bit too far, or in some cases, a lot too far. And when you're not providing accurate information to your people, and when the CDC, it seems, is requesting inaccurate information to be sent into its hands, there's every reason for people to distrust the government, because they're using a false basis, at least to some extent, for some of these restrictive policies. Now, the pandemic is real. Tens of thousands of Americans have died, for sure. But at the same time, when you're using these numbers as a basis, you need to make sure that you're presenting accurate and truthful information. Because otherwise, the people of these states may never trust you again, or it will take a long time for you to rebuild that trust. The fact that in Colorado, for example, it took a state legislator to find out that the executive branch was falsifying death records in order to boost the death count, it seems, to inflate it, is deeply troubling. And every American in Colorado, across the country, should be looking closely at the numbers and finding out, is this accurate? What numbers are being used? What is the basis for these policies? They cannot abuse the trust of the public just because they are governors or they are public health officials who've been appointed to their position because of areas of expertise. And they must all be held accountable. You just watched a clip from Jimmy at the Crossroads. Don't miss more engaging, intelligent talk. Subscribe to the Jimmy at the Crossroads YouTube channel today. You want to catch our live show. And I love your support.
I got Jimmy at the Crossroads, making sense out of no sense. Yeah.